Good morning, everybody. Yesterday we had over 125,000 people that came forward to get vaccinated in New South Wales, which is a fantastic number. We now have 6.1 million jabs given in New South Wales, and nearly 1/3 of our population is fully vaccinated. It's hovering at 32-point-something%, which is great at this stage. And if we keep these rates up, we will hit further milestones. Yesterday to 8 p.m. we had 919 cases of community transmission, and in addition to the very sad passing of the 30-year-old, which was reported yesterday, there was one additional death of a man in his 80s at Hornsby Hospital who did have underlying conditions. The suburbs of concern in Greater Sydney and Western Sydney remain Guildford, Auburn, Marylands, Greystanes, Granville, Punchbowl, Yagoona, Blacktown and surrounding suburbs. We really urge everybody in those communities to stay home. And if you must leave home, please assume you have the virus or somebody you're coming into contact with has the virus. Western New South Wales remains a concern for our health authorities, and other parts of the regions are demonstrating some stabilisation in the number of cases. Can I also give a call out to the 600 State Emergency Services volunteers who worked on 1,000 sites across, or 1,000 jobs across the state during these very difficult times. A pandemic doesn't stop other things from happening, and I just want to thank those volunteers for the safe way in which they addressed those situations they confronted. Can I again give a call out to all 16 to 39-year-olds in and around those local government areas of concern. So if you know you live in one of those areas where you've got those additional restrictions, if you're between 16 and 39, please go to newsouthwales.gov.au and you can book in a jab and get that jab within days. No waiting. And we really, really want everybody in that age group to come forward and get vaccinated. That will help keep you and your family safe, keep you and your loved ones out of hospital, but also obviously help us reduce the spread. And as Dr. Chant and all of our experts say, please know that once you get the jab, it takes between 2 and 3 weeks for it to have effect. So make sure you continue to do all those things we've asked you to do even when you're vaccinated, because we still don't have the vaccination rates where they need to be to offer enough protection for everybody. So make sure even when you get the jab that you're having a very strict adherence to the rules, but also assume you or somebody else you're in contact with has the virus. Today also we're joined by Dr. Lucy Morgan, who's a lung specialist at Nepean and Concord Hospital, and we're really pleased to have her here. She's an expert in her field, and obviously COVID affects the respiratory system, and she will give us important advice on the symptoms to look out for, when to call for an ambulance, but also the importance of getting vaccinated. Dr. Chant will now give the health update, and then Deputy Premier will talk about regional New South Wales, and then Dr. Morgan will talk about the importance of getting to hospital earlier rather than later, and the importance of vaccination. Thank you.
So there were 919 locally acquired cases of COVID in the 24 hours to 8 p.m. last night, and there were 2 overseas cases. 149,252 tests, so thank you. There are currently 645 COVID cases admitted to hospital, and we have 113 cases in our ICU. It is pleasing to see that 98 of the people in ICU are not vaccinated, and 14 have received their first dose, and 1 person has received 2 doses of a vaccine. And I think this highlights, and Dr. Morgan will be reflecting on this, the fact that vaccination is the key. We need to increase those vaccine coverage levels, and can I just urge everyone to take up the opportunity for vaccination as soon as possible. Sadly, we also are reporting 2 deaths. A woman in her 30s from Sydney's west died at her home, and her death is being investigated, has been referred to the coroner, and Western Sydney are also reviewing the circumstances surrounding that tragic death. A man in his 80s from Sydney's north died at Hornsby and Ku-ring-gai Hospital, having acquired his infection at the Greenwood Aged Care Facility in Normanhurst, and his is the 3rd death linked to that outbreak in the aged care facility. He had been vaccinated but had significant underlying health issues. In terms of the sewage surveillance, I want to particularly call out 3 areas where we do not have recognised cases, and we need to have high testing rates in those communities to flush out any unrecognised cases. So those areas are Batto Bay, Toukley and Merimbula. We're particularly concerned in relation to Merimbula, given its proximity to ACT, but its proximity to Sydney. So please, anyone in those areas, please, if you've got any symptoms, however mild, please come out and get tested. Thank you.
Well, good morning. Can I start by passing on my condolences to those families that lost loved ones overnight. You remain in our thoughts and prayers. In regional New South Wales, Western New South Wales Local Health District is still of grave concern. 49 new cases overnight. Dubbo with 35, Burke 7, Orange 5, Narromine 1 and 1 in Walgett. In the far west we had 7 cases again reporting to 8 p.m. last night. 6 were in Wilcannia and 1 Broken Hill. In the Hunter New England Local Health District, again 4 new cases, 1 in the Newcastle local government area, 1 in the Port Stephens local government area, 1 in the Cessnock local government area and 1 in Lake Macquarie. New cases again in the Illawarra Shoalhaven, 8 new cases reported overnight. 7 were in the Wollongong local government area and 1 in the Shell Harbour local government area. On the Central Coast, only 1 new case reported overnight. I do want to touch on the sewage surveillance, especially in Merimbula, a high level of surveillance there, and we are concerned because of the proximity to Canberra, knowing that many Canberrans had moved down to the south coast. We have no known cases. It's been an area that's been quite clean from COVID for a very, very long time, and we are asking the community to come out and be tested, and tested immediately, even for the mildest of symptoms. And of course, Batto Bay and Toukley are 2 other areas that we are concerned. On a positive note, again, the challenge to the regions is to get vaccinated. 3 areas or communities and local government areas that are doing exceptionally well. In Kiama, we're now up to 40% double dose, 68% single dose. In Eurobodalla, 39% double dose, 73.7% single dose, and Wingecarribee, 38.7% double dose and 65% single dose. And the biggest mover for me this week is Kyogle, going from 28.8% single dose up to 60.7% single dose. So again, call out to the regions, not only get tested in those areas of concern, but go out and get vaccinated.
Thank you, Premier. Hello, everybody. My name's Lucy Morgan, and I'm a lung specialist working at Concord and Nepean hospitals as part of the team looking after patients with COVID for Sydney's West. We've heard a lot about the importance of getting vaccinated. Every day at this press conference, we begin with hearing the number of patients who've caught COVID and the number of patients who've been vaccinated, and it's fantastic to see those numbers rising. It's been a wonderful community response to vaccines, and I want to thank every one of you. I know that some people are still worried about getting vaccinated, so I wanted to share some stories with you about what it's like and how it feels to fall ill with COVID-19. And my hope is that when we can understand a little bit more about how it feels to get sick with COVID-19, we might transfer some of our anxieties about the vaccine to feeling a bit more anxious about the illness and what we can do constructively to reduce our chances of falling ill with this. The big message for me today is get vaccinated. It's not too late to get vaccinated. Think about getting vaccinated today. The Delta strain of COVID-19 is incredibly infectious, and that's one of the problems for all of us. The tiny particles of the virus get into our bodies with the tiniest of contact. And this is why social distancing and staying at home really helps to contain the virus and contain the infection. It also explains why once the virus has infected one member of a household, it spreads so incredibly quickly within that household. So getting vaccinated protects you against catching that virus, but it also definitely reduces the chances that if you get infected, that you get sick enough to end up in hospital. It also reduces the chances that you will pass on that virus to other people in your household. So vaccination avoids the risk of serious illness and definitely reduces infectivity. Once you're exposed to this virus, most of us have very, very few symptoms in the early days. Unfortunately, you've already caught the virus and you are already passing that virus on. The first symptoms of COVID-19 virus are very much like any other cold or flu illness. They're often very mild, so mild as to be not really noticeable. But they'll be the ordinary cold and flu type symptoms. A headache, a bit of a sore throat, maybe a little bit of a cough. Some people have muscle aches and some people have fever in those early days. But some people become breathless and dizzy. And these are the sorts of symptoms that need urgent medical assistance. If you have COVID-19 and you feel breathless, you have trouble breathing, or you're feeling dizzy, you need to call an ambulance. An ambulance is free, your medical care will be free, and there'll be people who can care for you even if English is not your first language. The symptoms of COVID-19 that are affecting many of the patients that I've been caring for in the last few weeks include a really severe headache, not just a little bit of a headache, but a really severe migraine-like headache that makes you sensitive to light, has a stiff neck, and that takes more than just Panadol to relieve it. It's really awful. Many of my patients have terrible cough, the sort of cough that leaves you breathless, and they can't move or speak or walk without cough becoming really, really terrible. Lots of patients have diarrhea. Lots of patients have nausea. They just can't eat anything or drink anything. And people feel so overwhelmingly fatigued, it's all they can do is to lie on the bed. Some of these patients become increasingly breathless. So initially just breathless, walking quickly or making the bed, but as time goes by they become breathless, walking or even talking. If anybody is at home with symptoms this severe, they need to call an ambulance. Don't ring up and make a GP appointment, call an ambulance. Because these are the sorts of symptoms and signs that tell me that the COVID-19 illness is progressing and progressing quickly. As people become increasingly breathless, the oxygen in their blood starts to drop and they need increasing levels of extra support to keep that oxygen levels up. That might be oxygen via little nasal prongs that go into the nose, but as the things progress and as people get sicker, they may need actually a machine to do the breathing for them. And that's the point at which someone who's in a hospital having care for COVID-19 may require intensive care therapy, the sorts of treatments that Dr. Nguyen talked about on Monday. So a machine to do the breathing for you, a machine to possibly support your blood pressure and do the work of the organs in your body. So it's anything that we can do to reduce the severity of the illness and reduce the need to go into intensive care is very, very important. And getting vaccinated is clearly something that we can do to reduce this severe illness. One of the things that I noticed in my most recent days in the hospital was the heartbreaking stories of patients who were very, very young. I've been looking after patients in their 20s, in their 30s and in their 40s, many of whom have very young children, many of whom have partners who are in hospital, in other hospitals, dislocating their families. Many of these patients have children who've needed to be admitted to other hospitals so that there's someone who can care for them safely. All of them have extended families who've been impacted in many, many ways by the impact of COVID-19 illness. Not one person that I was caring for with severe respiratory illness over the last few days was fully vaccinated. But the good news in all of this is that this does not have to be you. You could get a vaccine today and reduce your risk of getting severe respiratory illness from COVID-19 and reduce your chances of ending up in hospital. 2 doses of COVID-19 vaccination will be your suit of armour. Will protect you from getting sick from COVID-19, from needing admission to hospital and from ending up in ICU. Book your vaccine today and protect your loved ones and protect yourself. Thanks very much.
Still at different levels, is New South Wales still on track to have some level of freedom?
Oh, absolutely. We've made the point that the most important figure moving forward is the rate of vaccination, and that remains the case. As soon as we hit all those milestones, we will have those extra freedoms, and we're looking forward as a team to announce tomorrow or the day after what life looks like in September for those who are fully vaccinated. This is really important message that no matter what the case numbers are doing, when you hit those high rates of vaccination, you're giving everybody protection. You're reducing the chance of the spread and you're keeping people out of hospital. And when you hit 70% double dose, as the Doherty report states, you start to transition into talking about the rate of hospitalisation, not the number of cases. The number of cases becomes less relevant. Now, I don't want to take away from the situation New South Wales is in, because every day we're working night and day to put downward pressure on those cases. Don't get me wrong. Every day we want to see case numbers go down, not go up. But moving forward, the most important number for us is how many people are protected, how many people have that suit of armour, because we know that keeps people out of hospital, it reduces their chance of being contagious, and it allows all of us to look forward to living life more freely. And that is really critical. As we said, we don't want people riding the roller coaster ride of cases going up and down. They will bounce around. They could go up, they could go down. But what we do need people to focus on is what you need to do to keep yourself safe, your family safe, and what all of us can do to reduce the spread, and that's really important.
How concerned are you that case numbers are now in the 900s? Because I think a lot of people will be quite alarmed by that.
Oh, look, there's no doubt that people would be alarmed with the rising case numbers, but it's, again, a mark of how well the vaccines work, that our hospitalisation rate is still relatively low. We don't want to see anybody in ICU, and we don't want Dr. Morgan to have more patients she has to look after as a lung specialist. And we know the vaccines are our best way of doing that. Even last year when there was that outbreak in Victoria, even though they had fewer cases, the death rate was much higher because the tool of the vaccine wasn't around. So what is really important for us, what is the measure of how well we're doing, is keeping people out of hospital and stopping people dying. And that is the most important measure. But what is also really important is when you have those high rates of vaccination, that adds protection. It allows us to live life more freely and gives us confidence to move forward, because every state in the nation is going to have to confront having Delta part of our lives moving forward. Lucy and
The hospital system, though, we know that Westmead overnight has shifted into emergency operations mode. They've ceased taking ambulances for 24 hours. They need 100 extra beds. It doesn't sound like it's necessarily coping. It's saying it's not business as usual anymore. How do people feel confident that the health system is going to be able to stand up if we're seeing this? And are other hospitals headed this way?
Look, I'll ask Minister Hazzard to comment on this point as well. But what is really important to note is that, as Dr. Nguyen said earlier in the week, she's one of the specialists that manages capacity across the state. We have been working hard as a team across health, across government agencies, across government, to make sure we've increased our capacity to be able to deal with extra numbers of cases, and of course across the entire network. There's no doubt that parts of our hospital network are under severe pressure when most of the cases, when 80% of cases are coming out of the same region. Of course that's going to put pressure on local hospitals. And I'll ask Minister Hazzard to make comment on that as well. But we've been preparing for that increased capacity, for the increased equipment and staff and all those things we need, and we can't pretend a pandemic is easy. We can't pretend there isn't going to be pressure on the system. Of course there is, and that is ongoing. But everybody who needs medical attention will receive it, and I'll ask Minister Hazzard to comment on that.
Thanks for that question. Look, there's no question that the health system is working under pressure. And I want to start off by just thanking all of the frontline staff, the doctors, the nurses, and all of the staff in the hospitals that make the hospitals work, that are keeping us all safe and looking after patients, as you've just heard from Dr. Morgan, patients who can be very, very ill with this virus. But I want to assure the community that we have been working, that is the health system, have been working on this since January, February last year, and making sure that we stepped up the number of available ICU beds, staff to work in those ICU or intensive care units, ventilators. But Westmead Hospital is typical of the sorts of pressures that you'd expect when you've got a major quaternary hospital sitting in the middle of the epicentre of the virus outbreak. I think it sits 3 or 4 kilometres from Granville, quite close to Marylands and the other suburbs that we have been calling out in the last few days. Currently, Westmead staff are managing, I think it's about 1,500 patients in the community, and they've got about 121 staff in their wards. I think there's about 23 of those are currently in ICU, in the intensive care unit. That's certainly a pressured situation for them. But the other aspect is they're also now able to work with the private hospitals. This was something that was set up last year by working with the federal government, and last Monday the situation was confirmed here in New South Wales, particularly in Sydney, that beds would be available in our private hospitals. Westmead will obviously work with Westmead Private and other private hospitals in the local area to make sure that some patients are able to be looked after in the private hospital as well. I want to stress, though, that it's not easy. Last week alone, Westmead Hospital had 280 patients who came in by ambulance with COVID. So about 40 ambulance deliveries a day with COVID. And each of those patients are being well cared for. You just heard Dr. Morgan talking about the level of care that's required. I'm confident that we have maybe a system that's under pressure, but it's a system that works. We have staff that are doing an incredible job looking after patients. But what I would say is just reinforce the message from Dr. Morgan. Please don't be a patient that comes to our hospital in the sense that don't get sick. Can you please go and get vaccinated? If you're thinking still about whether or not a vaccination is a good thing, can I tell you that, as Dr. Nguyen said a couple of days ago, it's not a great day when you have to meet the intensive care department of a hospital. So please just go and get vaccinated, and that will help take some of the pressure off our hospital system. One at a time, please. I'll go with Anne. Yeah.
So can you tell us what the R-effective rate of the virus is at the moment?
Yeah.
And I've seen some graphs that show that by the time we get to 70%, we could have up to 4,000, 5,000 people in hospital. Can we cope with that?
Look, the R-effective rate, according to our own public health advice, is about 1.3 at the present time. But it's variable, and of course, like all algorithms, it varies depending on the inputs. And I know that one of the joys of being the health minister is to have all the experts from all the different institutes all feeding in different data and coming out with what they consider the R effective. But certainly at the moment, it's about 1.3, which effectively means that for every 10 people who get the virus, they're going to infect another 13 people. So it will grow. But the one way to stop it growing, and the one way to stop you ending up in our intensive care unit or in our hospitals, is to get the vaccine. Sorry, I'll just go to James first and I'll come back to you, Clinton. Sorry?
You didn't answer Anne's question about whether the hospital system can cope with thousands and thousands of cases every day. And further to that, 919 cases a day, an R-effective rate of 1.3, Westmead Hospital is under emergency operations, people waiting for hours in the back of ambulances. What specifically are you doing to make sure that we can cope when cases continue to climb? Will we look at field hospitals in southwest Sydney?
The issue here is that the health system is world class. New South Wales health system is probably the best health system in the world, And all the information that is given to me from the doctors and nurses and our public health staff is that, yes, the system is coping. You've got to understand that the individual hospitals from time to time will be under all sorts of stress, particularly if they're sitting right in the epicentre of the breakout, which is Western Sydney and southwestern Sydney. And it may move to another area, but we're hoping that by people getting vaccinated, we'll actually be able to turn that down. Clinton. James, I've answered your question.
Minister, we've had reports that surgeries at RPA have been cancelled because beds are being set aside for potential patients who are involved in the protest on Saturday. Is there any information that protest yet, even though it was small, is some sort of super spreader event?
Look, all I'll say is that each of the hospitals are, and have been for quite some time, building their capacity to deal with the increasing number of COVID-positive patients. And that's part of what a hospital system does. When we have very bad flu seasons, it's a similar work that's done across the networks. Westmead, for example, is actually getting support from a range of other hospitals, and that's entirely normal. So I don't have any concerns at this stage that is not being dealt with appropriately. In regard to the demonstration, could I just say you'd have to be reasonably certain that a number of those people who've ended up in our hospitals were at those were at that large demonstration. A demonstration is completely wrong when you're in the middle of a pandemic, and to think that there were people who went along in vast numbers and actually thought it was okay to go and demonstrate against the sorts of safeguards that have been put in place is just ridiculous. And I have no doubt that there are probably people sitting in our hospital system at the moment requiring our health staff to put their lives at risk to look after them when they thought that it was okay to go along to a demonstration. Sorry, Ursula. Sorry. Can I come back to you now, please?
James was asking. We are hearing that these hospitals, we're hearing from people on the inside of these hospitals, nurses, from paramedics, saying it is not coping, that they have wards that are being shut down, that patients are being shunted about to different wards when there is a COVID infection or a COVID scare. We've got COVID patients sitting outside in ambulances for 12 hours. They've been shunting between hospitals because they won't take them. We've now seen not one but 3 hospitals shut down for COVID patients today. Is it coping or is it not coping?
The hospital system is coping, but there are lots of pressures on individual hospitals from time to time. And I don't doubt that individual staff in some of those wards are finding that there's a lot of stress on them as a result of the number of patients coming in. But I stress again, we have a very, very good hospital system across New South Wales. And indeed, there's a lot of backup for Westmead at the moment. The patients, for example, the 1,500 that are being managed in the broader community are actually being assisted by Calvary Health, as you'd expect. There's support coming in from each of the other hospitals. What you've also got to understand, though, is that staff at Westmead, a number of staff have been taken off because of being exposed to the virus. So the health system likes to use the term furloughed, but I think for the rest of us it just means that they have to be taken offline. They're not working. So there are less staff available. There are also less staff available in each of our hospitals because a lot of them have been taken off to work in our mass vaccination hubs. And that's there for the community to go and get vaccinated. I want to stress that if we have staff waiting for you to come, you should come to get vaccinated. At the moment, there's about 200,000 vacancies through to the 5th of September for authorised workers, including disability workers, including people who work with children. So I would just stress to you that fill those vacancies and fill them quickly. But I have no doubt that individual staff will be finding it stressful, and that's why I started off by thanking them, because I think, I talk to staff, we've got doctors here today, they're all a bit frustrated. They're frustrated that so many people have chosen to just drag the chain when it comes to getting vaccinated. There are others who've tried, of course, but have not been able to get in because of the age categories that have changed as a result of the federal government advisory body's advice. But right now we are vaccinating people from 16 to 39, of course older people as well. And you have a whole range of places you can go and get vaccinated. It's not just at the state-run big vaccination centres. You can go to your local pharmacist, you can go to your GP. My strong advice, off the back of what Dr. Morgan just told us, is You don't want to be that person in the intensive care unit where you are struggling to breathe. Go and get vaccinated. Liz, please.
We're hearing from whole families who've been texted that they're positive with COVID. So, for example, on Sunday they got the text saying that they're positive with COVID. They're still yet to hear...
So the whole family or one person in the family?
The whole family.
Yep, yep. Mm-hmm.
And they're yet to hear from health officials. Given what we've just heard about how important it is to get care early, not to mention to contact trace all their contacts that this is a positive case, how concerned are you that contact tracers are not keeping up with getting in touch, or New South Wales Health is not getting in touch with people who we know are COVID positive?
Look, there's no doubt about it that the tracers are under pressure at the moment, as is the entire health system. But what I would say is that help is there for you, and as Dr Morgan said, if you have any concerns, ring your local hospital and make arrangements to come in to the emergency department. And I'll ask Dr Chant whether she'd like to add anything further, because I have a feeling on my left there that she does. Dr Chant?
I think we have to be very honest that the surge in cases has put stress on both the health system and the public health contact tracers. We've instituted a range of measures to support the timely results. So at the moment people get a text message and they actually get a phone number in that message. So they're able to phone someone if they've got any concerns. That message has embedded guidance and links to multiple languages to ensure that they understand what they need to do as a case, and we advise that everyone in that household has to get tested and remain in situ. We are also working up so that their information is provided daily to police. So police are actually doing daily welfare checks. We provide the information to police, and police will go and door knock and check the welfare of those individuals. In addition, our clinical services in the districts are now going to get direct visualisation of that list so they can also separately make contact. But there is a number embedded in that message that they can ring to seek assistance. So I just want to be very clear with the community. The surge in cases and the delay in our testing turnaround times has meant that people have been tested 3 days ago and have not got. So part of it is the delay in the testing turnarounds, and as you're aware, we've turned off a lot of the surveillance testing to actually improve that testing turnaround time. So my other message is, if you are just getting a COVID test for the sake of it, you don't have symptoms, you've not been exposed, you're not in an area of concern, please do not use those scarce testing resources, because we need to get the turnaround times for tests down as soon as possible. Argue that given we're at 919 or at 800 or 900 cases a day, there's this complacency creeping in that, it doesn't matter how low our case numbers or how high, we don't need to get our case numbers down because we're going to get out when we get to 70 or 80% vaccination anyway, and the system clearly is under so much strain at this level. My key message to you, and this is why I am just so much appealing to the people of South West Sydney and Western Sydney who have been given priority access to the Pfizer vaccine through a number of channels. Please do not waste this opportunity. This opportunity is for you individually, for your family and loved ones, but it is also for the community. So just to be clear, this is a public health intervention in vaccinating the 16 to 39-year-olds and getting the authorised workers. What we need to see is the vaccine coverage in those cohorts, those groups of people, as high as possible. The modelling suggests that if we can get that group vaccinated, we will break the transmission chain. It will take a while, and that's why when I was questioned yesterday, I said the numbers were going to bounce around and potentially go up. That's what we believe before they come down. But the solution is in our hands. And I urge everyone in those local government areas who have access to that vaccine to fill those appointment vacancies and get a vaccine. If we get those high levels, the modelling shows we will change the R effective and we will see a decline in cases. We have a choice. If we embrace vaccination, we will get there sooner, and that is everyone, but a based on the current
But based on the current modelling, how long do you think it will take to break that chain, to get that cohort in particular vaccinated as quick as possible? Are we talking weeks? Are we talking months?
What we are talking about is ultimately the model is the greatest impact is the level of coverage we get in those groups. So the higher we can get, and I'm actually confident that that Australians generally embrace vaccination. And I can't see that we can't achieve incredibly high rates of vaccination. But I want to convey a sense of opportunity, the opportunity we've given the residents in that area to vaccinate themselves, to protect themselves and their loved ones. But obviously I'm also reflecting that that is the best thing they can do for their broader community and the broader New South Wales is by getting a vaccine.
Westmead, you know, having to stop taking COVID patients for 24 hours, possibly longer. Is it time, do we need to start thinking about a COVID-specific hospital, a hospital that only deals with COVID, or a field hospital? Have you considered that at all, as was done overseas?
In general, field hospitals are really not what we need in Sydney. Field hospitals are for particular circumstances where you might be in a rural or remote. There might be a train thing and you might have it as a staging post to stabilise people. That's the concept of a field hospital. For COVID patients, and I would defer to Dr. Morgan, we need oxygen. We need copious oxygen supplies. We need a safe environment. We need social distancing. We need beds. We need ability to feed people, care for them, access to drugs, access to IV therapies, access to ICU. So we do have a number of facilities, and as the Minister indicated, we have got the capacity to work with our private hospitals, of which we have significant bed capacity, and our hospitals will be doing a lot of local planning about which patients are best cared for in which circumstance. So just be assured that a lot of that integrated planning across our health system has occurred in preparation for a variety of different scenarios, and those plans are being implemented. So my key message, also echoing Dr. Morgan's comments today, was please do not defer care. Do not think I won't respond if I've got some chest pain. I'm feeling short of breath. I don't want to burden the health system. The health system is there. Call the ambulance and please do not delay care because we do not want any consequences from delayed care.
On ICU beds, Dr. Chant, there are 592 commissioned ICU beds according to the New South Wales Adult Intensive Care Services Pandemic Response Planning Report. Is that not correct?
So I think that the issue around ICU beds is we obviously started off the pandemic with a baseline bed capacity. We have the capacity, and I would again defer to Dr. Morgan, but we have the capacity to turn high dependency units into intensive care by upscaling the clinical staff and the supervision. So, and we also have our private hospital capacity and intensive care. So there's been a lot of planning capacity for that. But can I just say, as a public health clinician, prevention is the key. So we also have the tools in our hands for prevention, and I would be much prefer focusing on what we can do, and that is about getting vaccine coverage up. And as Dr. Morgan said, your chance, and I've been saying every day, your chances of needing hospital care, your chances of needing ICU are reduced even with one dose. We are saying that 2 doses does fortify that armour. It's not always, no vaccine is going to be entirely perfect, but that's a pretty good fortification, and these are good vaccines.
If I could ask, on vaccines, the federal advice, it seems, is imminent on the 12 to 15 age group. Can you give us an idea of how imminently or how quickly we can get those vaccines to that group? Do we have enough supply to do that?
The vaccines that would be used in the 12 to 15 would be obviously Pfizer vaccine, in terms of that's been registered for that use for children 12 to 15 with underlying health conditions and Aboriginal children currently. So in terms of if there was an announcement about the 12 to 15s, it would be Pfizer. At the moment, we still have constrained supply. And so again, if that booking system was opened, children 12 to 15 would have access through the usual way, but we are still in a supply constrained environment.
Are you able to give us an an idea from a timetabling perspective, though?
It will be as soon as...
Given primary schools...
I suspect it will be when the Commonwealth receives that advice from ATAGI. They will act on it promptly.
The young lady who died in Western Sydney, did she deteriorate quite quickly? Were health staff in contact with her? I understand the whole family's infected. What's happened?
I think it's appropriate just to say that the death has been referred to the coroner, and the hospital is looking at all of the circumstances of it. I know that she was offered accommodation at the Sydney Health accommodation, but I don't really want to go through any of those issues. It's best that we thoroughly investigate. It is important, and I think I can't stress enough that if you've got any symptoms, regardless if you've been in contact with our health teams in the morning or at any other time, it's critical that you call an ambulance if you have dizziness or worsening or any symptoms of breathlessness.
Dr. Chant, you talked about delays in testing and also that you were getting to the limits of your contact tracing, or it was becoming very difficult. At what point do you have to stop contact tracing?
We will never stop contact tracing. It's an effective public health intervention. What we're doing is doing it smarter and scaling. So, for instance, the innovation of the text message, we're also embedding in the text message, for instance, little surveys where people can tell us whether they're a household member or whether they're aged care or they're in a critical workplace. Again, because obviously a household member in isolation doesn't pose as much need for us to do further public health. So we are looking, turning our mind to all of the innovations. I've got to say that increasing case numbers do challenge our services, but we're supported by a broad team to look at how best we can focus. And I also want to extend my appreciation for police, who are taking that important aspect of welfare checks, because then they can make people aware of the payments and isolation payments, provide welfare connection so that people are well supported. So it's really a clinical care, the welfare of individuals, and certainly then the public health follow-up.
Can I ask the Deputy a question? Mr Barilaro, the Tweed Heads MP says the whole state's lockdown is about to be extended for 6 weeks. Can you clarify that?
Thanks for the news flash. The government and the crisis committee will be considering what happens post Saturday. We haven't made any decision around the extension of the restrictions of a lockdown for regional rural New South Wales, but as you can see in the numbers today, the Central West isn't getting better, the Far West isn't getting better. The Hunter New England, even though under control, still has cases amongst a number of local government areas. In the Central Coast, the Illawarra, Shoalhaven, Wollongong again, the highest number of cases in this outbreak. Shoal Harbour, we've got the issue in Canberra yesterday posting its highest level of infections in Canberra, which does put pressure on the southern New South Wales, and this morning already sewage surveillance showing that in Merimbula, high case of surveillance. So in one way, you've got to manage all of that, and the reality, this is about protecting lives and making sure we don't lose control in regional rural New South Wales. We've also got the threat that's happening in Victoria and regional Victoria on the Albury-Wodonga or the New South Wales-Victoria border, especially places like Shepparton. So we'll look at all that. We'll take the advice from Dr. Kerry Chant and her team, and the crisis committee will make a decision. And like last week, we'll make that decision sooner rather than later and give people plenty of notice.
Are you monitoring online streaming of church services? Because we're seeing clear video evidence that rules are being broken, people are singing, there's no masks. You know, how concerning is that, given we know that this can be high transmission occurrence?
It's very concerning to the police operation, and I can reassure the community that there's every effort going into those particular church services that are coming up on streaming, and pieces of information that are saying other church services are going to occur. There's proactive work going around talking to pastors and others at those churches to dissuade them from doing that. But Commissioner Fuller has made it very clear that that activity cannot go on, and police will go to those locations at those times and take the appropriate action.
Deputy Commissioner, we've had reports of people who have
have been fined while standing outside eating, and this was in Potts Point. Can you just please clarify what is the definition of recreation under the Public Health Order, and does eating and drinking fall under that? I mean, should people be fined for standing around eating or having a cup of coffee while standing in the outdoors?
Yeah. Look, I have every confidence in New South Wales Police and each individual police officer to make a decision around what fits in the public health order and what clearly sits outside of it. Every day I come here and talk about hundreds of infringement notices, 537 again in the last 24 hours. Those infringement notices are issued to people that don't sit in that grey area, that are clearly sit outside the public health order. In terms of food, people need to understand that it's takeaway. It is takeaway. That's the general rule, is takeaway. So if you buy food or a cup of coffee, that you need to take that away and consume that. I'm not aware of those individual circumstances, but police still have discretion. But let's be very, very clear that we're in a pandemic. We are in a situation that we want people to absolutely comply with the public health orders, and police will take action where they think that's appropriate.
Are you worried against a lot of resistance? If police are fining people for eating outside and then tomorrow in out so you can go to the hairdresser or get your nails done?
Look, I think that the vast majority, and I've said before, millions of people do absolutely the right thing every single day. And that is refreshing in terms of everyone wanting to get out of the pandemic and back to some more freedoms in the shortest time frame possible. But, you know, New South Wales Police is a very large organisation. It collects a lot of information, a lot of intelligence. It tasks and deploys our police every single day to locations where there's transmission, where there's Crime Stopper reports of people doing the wrong thing. Generally, New South Wales Police will easily cope with whatever is dished up to them, and we're very confident that we can support New South Wales Health and communities to get through what is still a very challenging time.
Dr. Chant, can I just ask you in regards to the case? Last couple of questions.
So in regards to kids can't get vaccinated, especially kids under 12. So vaccinated teachers will be key to getting schools back in Term 4. I know you've been asked about this before, but can we just get a clear answer? Will you add teachers to the list of prioritised workers to get a Pfizer vaccine, or will they have to get AstraZeneca? Will you look to make vaccines mandatory for teachers in a bid to get kids back to school or not?
Well, obviously our messages remain consistent. We look forward to saying something about schools tomorrow or the day after. We've already asked everybody between the ages of 16 to 39 in those local government areas of concern to come forward and get the vaccine. We've already put a call out to groups like teachers in those communities to come forward and get vaccinated. And we also know that in areas outside those areas of concern, a high degree of vaccination has occurred amongst teachers already, and everybody has access to a vaccine. Don't be fussy, come forward and get vaccinated.
Last question, Chant. I'm sorry, can I just ask you about the case numbers? While the vaccine rate's obviously quite high at the moment, people would be looking at the cases in the 900s today and getting a bit worried. From a health perspective, are you still comfortable at looking at easing something by the end of August?
The way I would be defining this is that this is going to be a journey with the community. We need to maintain those the high levels of compliance, and we need to get vaccine coverage up as soon as possible. So every day I look at the data around vaccine coverage, and I look at the geographical distribution of that. I'm most interested in seeing those vaccine rates come up in those local government areas. So every day we are looking at a large number of data points, and then we provide our advice to government about the situation. But on my final note, get vaccinated, and for the people of southwestern Sydney and Western Sydney, go to that website, book in. There are bookings available. We need you to do that for yourselves, your loved ones, your community, and the broader community.